every successful surgery starts with the right diagnosis. There are common symptoms that bring a patient to the hospital, and these are a headache most of the time, low back pain, or seizures. There are other symptoms also that we take seriously, like visual impairment. When patient presents with any of these, we take time and assess the patient based on these symptoms. Because every part of the brain has a function it does, and when that part of the brain is dysfunctional or sick, patient comes down with those symptoms. So when a patient comes, we take time to assess them, finding out other things associated with these problems they are complaining about, and with it we're able to know the direction as to what is wrong with the patient. So, and that takes us to the next step in assessing this patient, which is examination. Examination is an essential part of making a diagnosis. It involves assessing the patient's mental state, then assessing also his physiological functions, and then assessing his movement. In a summary, we call look, see, and feel, and also move. So these are the components of examination. In examining his state of mind, these are the components of important questions. I need to assess his memory, find out how he remembers things. I need to talk to him, and he has to talk to me back so that I can assess his speech. Then there are other things he has to do for me, so that I'll be sure he's coordinating well. Then also, in the examination, I need to assess he has to do for me, the extent he can see and read. Then also, it's important because some tumors, some brain conditions will make a patient not to be able to read, and also limit the range of vision of the patient, what we call the visual field. And also, I have to assess the patient, see the extent he can see, check his visual field, whether he can see by the sides or whether he can see only the things in front of him. These are all see by the sides or whether distinguishing one disease entity from another. Then the range of vision, assess his reflexes. Because some disease conditions assess his reflexes. So in assessing his reflexes, I'll be able to know where his problems are coming from: the spinal cord, the brain, or peripheral nerve. Spinal cord, which is within here, the peripheral nerve. So these are things I need to assess so as to be able to arrive at a good and comprehensive diagnosis. Investigations are the means of confirming your diagnosis. And in neurosurgery, we use imaging to confirm our diagnosis. So, for instance, this is a brain MRI of a patient. This is a brain MRI. To confirm his diagnosis, we have to do this MRI, look at the brain, look at the structures within the brain, and then look for where the problem is. Like in this one, I can see the problem here in the brainstem. It is aiding me to confirm the diagnosis, which I already made when I saw the patient and examined him.